2.
What did you learn about sex ed
When you were in school?
when you were in school?
Okay. I learned a lot about sex ed when I was in school. When I was in 5th and 6th grade, they separated all the boys from the girls, and we went into separate rooms, and we learned about the menstrual cycle, or what happens to the young boys as they are going to start to go through puberty. And then as I went into junior high in 7th and 8th grade, we also had sex education in our home economics class. Again, learning about stages of puberty, various terms, knowing the parts of the body for both male and female anatomy. And then when I went into high school, I had an additional round of sex education from 9th grade to 12th grade. We had to take health class every year for 4 years, and within that we had a lot of sex education, talking about STDs, covering all the various STD statistics for the state of Connecticut as well as nationwide. Again, learning about male and female anatomy, and as you get older, there are more terms of the body that we needed to know, and so we learned a lot of that through sex ed as well. How to practice safer sex. We learned about birth control, all the various types of birth control. So that, as high school students, we were as well prepared. We were pretty well prepared, I'd say. I think my high school did a really good job. And then even in college, you have to take health classes. And so, again, there will be a portion of that where they will go over sex education.
Well, has sex ed changed since you learned about it?
Well, the only place that I really have to compare from my high school and college experience with learning about sex education is here at Common Ground. So Common Ground curriculum is not really designed for formal sex education. We unfortunately don't have a health class where you can get an extended period of weeks into even months about sex education. And we had health class daily. It wasn't once or twice a week, so this was Monday through Friday for an extended period of weeks that we learned about sex education. So, but one of the things that I guess has changed overall is learning about the new STD, human papillomavirus, HPV, which, just in case you didn't know, can be transmitted through condoms. So, it's really important that people know how to continuously check for those, and for females, they need to be going for regular pap smears through their gynecologist.
So what do you think sex ed is lacking?
In general, or here at Common Ground, like in general within the U.S., or here at Common Ground High School?
Both.
For Common Ground High School, it would be really helpful, I think, if we had a consistent sex education curriculum where I think Planned Parenthood is a fabulous organization, and I'm so pleased that they work with us. I'm a true believer in Planned Parenthood. However, it would be more beneficial to our students if they could have a consistent health teacher / sex education class that met more than twice a week for just a couple of weeks, which is how it works with Planned Parenthood. If you guys were able to have sex education on a daily basis for an extended period of weeks, you learn a lot more. Right now, Planned Parenthood's only able to cover the surface level, so there's a lot of misconceptions that I realize that our high school students have, misconceptions that when I was in high school I didn't have. Those things were quite cleared up because you had many days to ask your questions and figure out the answer. As far as the nation goes,
just real quick, like what kind of misconceptions do you think some of our students have?
Well, one, not knowing about the human papillomavirus and that it is transmitted through condoms. Also, not being fully aware of what a regular pap smear is, and for teens who have certainly hit puberty and may be sexually active, they should be going to a gynecologist and having a regular pap smear. Also not knowing the various types of STDs that are out there. I know that in science class you guys go over some STDs, but what happens if a student doesn't take that particular science class or that session? Or maybe they took biology their freshman year, but by their junior year they're a little foggy and hazy about all the STDs, or even how pregnancy can work. Some students still, have the concept that, well, if I have unprotected sex once because it's my first time, I can't get pregnant. You know, when I still hear that amongst students, that just, you know, makes me, you know, and those are some of the misconceptions.
That you can still get STD even while wearing a condom.
Even while wearing a condom, right?
Yes.
So, those are some.
So, what information would you want your kids and teens to know about sex or sex education?
That anyone could become pregnant at any time, that even if you are on birth control, you can still become pregnant, that condoms are not birth control. Condoms are used to help prevent STDs, but that doesn't mean that that will necessarily happen. Also, students should know like where they can go for help, and know that, you know, certain organizations like Planned Parenthood is a place where students can seek out help and free condoms, because condoms do cost money, and that they can go there for information as well. So it's also an organization that will help people who don't have insurance, which is really helpful.
Right. So at what age is sex ed most appropriate, and who should they learn from?
Well, I think as soon as young, like preteens are starting to enter puberty, prior to that they should start learning about sex education and how one can become pregnant. Maybe, you know, because, you know, sometimes you'll have really young moms at the age of 12, 13, or 14. You know, one of the reasons why they may become moms is because they didn't understand how pregnancy works or how easy it can be to become pregnant with protected or unprotected sex. So I think preteen, you know, when you start learning about the menstrual cycle and when, you know, young boys start learning about things like wet dreams and what it is for an erection, that's the time that they should start learning about sex ed. Certainly in junior high and throughout high school. Now, as far as who should teach them, I mean, ultimately it would be wonderful if it began in the home. I think additional information is certainly needed at school because not every parent is as educated about sex as, you know, as a certified school teacher will be, for, you know, like a health teacher, say. You know, and that's not to say that every parent is going to look up the information on their own and try to provide their child with information. Some parents are really uncomfortable talking about sex, unfortunately, and so that may also make it difficult. Which is why it's then, I feel, important for the school to make sure that sex ed is being provided, because if it's not happening in school, chances are it might not be happening.
Okay. So, back to a previous question, what do you feel the nation is lacking in sex ed?
Don't really know. I try to think of like my travels across the country, and I mean, you know, people have children at different ages depending on where you are in the country and your cultural background. And religious too. I mean, religious backgrounds are going to determine how much sex education information someone may have. You know, a more religious community, for example, just using an example, somewhere out in the Midwest may not allow for sex ed to be taught in school. You know, because they're thinking of abstinence. Well, you know...
Do you think that works a lot?
Should I be honest? I mean,
Yeah, as honest.
Okay, so, you know, Sarah Palin's daughter, you know, Sarah Palin promotes abstinence. Her daughter's 17 and had a child. Does it always work? No. You know, a parent's going to promote something like abstinence, but really when it comes down to it, that parent is not there when that sexual encounter occurs. That parent is not there making sure, like, oh, do you have all your necessary materials to avoid pregnancy? Because some parents feel that their children shouldn't be having sex until marriage happens. And whatever someone's personal and religious belief is, that's their belief. And then there's the reality of what might happen to, if not them, maybe a friend, someone they know, someone on TV. So I think that practicing abstinence is... you know, I think it's positive for people to practice abstinence, and I think it's positive for it to be promoted within your family or your cultural or religious surrounding. However, many societies may not, you know, abstinence is not the answer, because obviously many people are still having sex, or we wouldn't have so many young mothers, you know, and unwed mothers or unprepared mothers as well. So maybe parenting courses. I'm gonna retract it. I'm gonna say, perhaps parenting courses across the nation would be very helpful. Imagine if every teen had to do a parenting course in 9th grade. Maybe they think twice about wanting to become a baby mama.
Yeah, the reality
Right.
versus.
Do you think the more, going back to, how a teen feels, the more you tell a teen, no, I'm not going to do it?
Again, how well educated is that teen? If a teen's not well educated, then they're not going to see the downfalls. They're not going to see, the negative outcomes or the negative consequences. It's more than just having a baby. Then it comes time to feed the baby, and how do you feed the baby, and how do you get the money for that? Babies cost money. And I don't want to just focus on just pregnancy. Because then if you think about STDs, some teen or young adult attracts an STD. That's going to cost money too to try to clear up. Not to mention, God forbid, you don't want to try to spread it to other people. Then that creates more of an issue. Of course, AIDS and HIV, drug use, all of these play in. And I'll be honest, I forgot the question that you even asked me right now. I went on a tangent.
So, the more that you say no.
No, the battery's dying.
The more you tell a teen no,
Sorry.
don't have sex, don't have sex, don't have sex. You think that works?
No, I think they're still going to have sex if they want to. Like I said, the adult is not there when that moment happens. Hopefully they get enough education from their home surroundings and their school to make adult choices and responsible choices.
So basically, you just think that overall everyone should have a more thorough sex ed education than what they're really getting.
Yeah. And like I said, at Common Ground, I think we do the best that we can at the moment. I think that there is certainly room for improvement. There's obviously room for improvement across the nation. To not have so many. I'm not sure statistically where we rank in the amount of teens who are parents.
We are the #1 developed country with teen pregnancies.
Okay. And did they give you the number one
We're the
country?
most, too.
And the most amount of teen pregnancies? So doesn't that kind of tell you that we need more education overall, that it needs to be more, and not just for students, in the home too, parents need to know. Parents need to know how to talk to their children about sex.
And because we're the most teen pregnancies, we're also the most, teen abortions. Between the ages of 15 and 19, over, I think it's over 1 million a year get abortions.
Guys.
Like a third of that.
So,
So we're good. Thanks.
thank
Is that
you.
ever done?
Yeah.